in the participant list. So I'm very excited to talk to all of you today. And welcome to the final in our series, Community Connections, Air Quality and Lung Health web series. This is a partnership between the Arizona and Nevada markets where we have been exploring the effects on air pollution in our communities. Next slide, please. So air pollution and climate change. I mean, all of you know the American Lung Association's mission is to save lives by improving lung health and preventing lung disease. But some of you may be saying, why climate change? Well, between droughts and wildfires, heat, flooding, and increased air pollution, these are just a few of the challenges millions of Americans encounter from climate change. It is a health emergency. And from the direct impact of temperature, weather change, and the special burdens these challenges place on our most vulnerable communities. I'm tongue-tied today. Climate change is a serious threat to our wellness, especially our lung health. So we're privileged today to welcome a guest speaker, Dr. Brian Drummond, Clinical Associate Professor from University of Arizona. Next slide, please. Before we get started, I would love to thank the sponsors of this web series, Dignity Health, Kindred at Home, Matrix Medical Network, NV Energy Foundation, Optum Care Lung and Allergy, SRP, Coca-Cola, True West Credit Union, University Medical Center, and UNLV School of Medicine. Thank you all for sponsoring and supporting this web series. What you will learn today. So today, Dr. Drummond will take us through the relationship of climate change to patient respiratory health. In addition, behavior modifications to mitigate exposure and individual actions to reverse climate change effects. So with that being said, please join me in welcoming Dr. Brian Drummond. Thank you.
Hi, thank you, Shannon. Hi, everyone. Thank you for letting me come and chat with you today. I'm pretty informal with my talks, so if you have any questions at any point, please put them in the chat. We can pause and try to address those as we go. We have plenty of time today to do that. And hopefully you'll have some takeaway points at the end of this and be a little bit more knowledgeable about climate change and respiratory health from where we started. Just as a little background on myself, so I'm an emergency physician here in Tucson, Arizona. I was born and raised in San Diego, so I've kind of been in the Southwest my whole life. And I was in the Navy for 10 years, went to Iraq. And part of how I got interested in climate and environmental affairs was when I was in Guam, there are two things that really caught my eye. One, there's a beautiful coastline, and every day I would drive by and see a energy factory that was burning oil and just spewing gas into the atmosphere. And it's just such a contradiction seeing that to the clear blue ocean. And the other thing I saw was driving to my home, there was a trash dump on the way, and each year, in the 3 years that I was there, the trash dump got bigger and bigger and bigger. And I just thought that we could do better, and I should probably be part of that. So that kind of focused me in more environmental education and learning. And now I have seen this as going forward for the rest of my career, kind of a shift in where I'm going to be focused more on climate change, patient health, and climate health in general, and being an educator in that aspect. So with that, we're just going to talk about respiratory illness and how climate change is affecting it. So how is climate change affecting respiratory health for patients? Well, there's really kind of four areas I'm going to cover today. One, we're going to talk about ozone. Two, we're going to talk about particulate matter. You'll hear me reference P10 and P2.5. Those are 2.5 and 10 microns, so they're particulate P, and then 10 a micron, less than 10 microns, so it's the size of the particulate matter. And we're going to talk about allergenic particles, and then we're going to talk about greenhouse gases and how they impact. Next slide. So ozone, I think a lot of us got introduced to ozone probably 20, 30 years ago when we started hearing like there's a hole in this ozone layer and the ozone layer is protecting us and Antarctica is going to melt because the ozone layer is melting. And so that was kind of the first introduction, at least I can remember, to ozone. But there's two levels of ozone. So that protective layer is the high zone or higher ozone. And the more dangerous level is the ground level ozone. So when we talk about ground level ozone, ozone is O3, so 3 oxygen molecules together. And it's formed at a ground level, and that is not a protective layer of UV light. So that's more of the dangerous area. And so we talk about ozone and low zone ozone. It's kind of a fun thing to say, but low zone ozone we're talking about is, in a sense, smog. So when you think smog, think kind of that same perspective. Next slide. So how is this low zone ozone formed? Well, there's a couple components. The first is you need sunlight, and ozone forms the most on the hottest days with the most sunlight. So the hotter it is and the higher the sun, the more likely ozone will form during that time of the day. And then you have to have a nitrogen oxide. We'll talk about where those come from. And then a VOC, or a volatile organic compound. And then the combination of those three, they basically bake, in that ultraviolet energy from the sunlight bakes these and creates the O3, or ozone. Next slide. So the sun obviously comes out every day. That's something we can't really change in terms of ozone production, but where are these other chemicals coming from? So there's 3 main components that are putting the VOCs and the nitric oxides out into the atmosphere. So the first would be burning of fuel sources for transportation, mainly cars, trucks, even your landscape blowers or weed whackers that people have, those small engines, are burning oil-based products and releasing VOCs and nitric oxides. The second area would be from industrial processes. So things like chemical plants, maybe they're making plastics, maybe it's a cement factory, maybe it's a fertilizer factory. Those are high intense energy requiring production lines. And for those to have that energy production, you're going to usually be using fossil fuels. We're trying to transition in that, but right now, those sources are producing a lot of VOCs and nitric oxides. And then the last portion we talk about is kind of the residential area. And so a lot of places are heating or cooling their home with either propane or natural gas or oils. And so those can release some VOCs as well. So during the day, as most of these factories and people are driving during the day and they're cooling their house or using that during the day, more VOCs are released. They mix with the sunlight, and then the low zone ozone is formed. Next slide, please. So we look about what is ozone affecting in terms of a respiratory status or how it's affecting our patients. There's a couple things where we see it affecting. So in kids, we see it, causing wheezing, coughing episodes, asthma attack, increased respiratory illness because of the irritant that the ozone is doing to the lung. Now, we don't know the exact mechanism by which. Is this a direct irritant? There's some studies that show maybe that there's a sugar production change in the respiratory cells, and that's leading to these effects. We don't know. But we do know, like the EPA has put out, that the healthcare effects of ozone is about $5 billion a year in premature deaths, hospitalizations, ER visits, and school absences. It also, in adults, can flare up someone's asthma, someone's COPD, maybe their pulmonary hypertension, and they have an increased susceptibility to infections, be that pneumonia or respiratory illnesses, and leads to premature death in these patients as well. And any questions on ozone before I move on?
There are no questions yet.
Perfect. All right, let's go on to particulates. Next slide. So we talked about particulates. We're talking about here wildfires, right? So the wildfires are the sources of these. And there's been an increased number of wildfires, including severity of the wildfire, as well as duration which they're lasting. And this is relatable to climate change. Some people argue that there's multiple causes of this, but what's happening is there's a decreased resiliency in our forests. And forests naturally will have wildfires. That's part of the natural cycle. Some plants are even based on, a high heat and a fire. They don't reproduce or germinate until those conditions are met. But what we're seeing is with the drought that's been going on, the increased heat from climate change, those are leading to decreased resiliency of these forests where the trees are drier and more prone to go into a forest fire state. Now, people will argue the forest management's been part of it, and yes, that is part of it, but that is also another human-related cause of why our forests are having more fires. And I don't know about you, but I've noticed smoke even the last couple of days here in Tucson, but fires have already been going on this year. So when these fires are releasing these particulates, and they're affecting patients with asthma, they're affecting patients, they lead to an increased cancer risk from these particulate exposures, more inflammation in the lung, and sometimes cardiovascular disease like heart attacks as well. So next slide. So we talk about the particulates. What we're talking about are these really small particles that have been created from the burning of plant-based materials. So when the tree or grasses or shrubs are burning, particulates are released in addition to carbon monoxide, nitric oxides, and some volatile organic compounds. Now, those are not particulates themselves, but these particulates are super small. So we talked about the P2.5 and P10. Those are kind of some areas they give you in terms of less than 2.5 microns or less than 10 microns. And because they're so small, and you can see in the image here, it's comparing to a human hair, which is about 50 microns. And so because they're so small, they can penetrate very deep into the lung tissue, going deeper than a lot of other particulate matter, including like pollens or things that we talk about. So because they're going down deep, they're causing more damage where the oxygen's being transferred across the blood-brain blood barrier in the lungs. So these particulates not just are affecting those patients who are in the actual area where the fire is, right? Because trees are burning, smoke's right there. But now with climate change, we're seeing increased heat and wind effects, which is spreading the smoke all the way across the country. So it's not just local to that area, but it could be, multiple states over or even coast to coast. Next slide.
There is a question that popped up in the Q&A,
Yes.
and you may touch on this later, but I wanted to put it out there now. The question is, how do our dust storms in the desert contribute to particulates?
Right, so dust storms contribute to particulates in a couple ways. So one, it just depends on what the dust is kicking up. Is it more in just a sand-based area? And those particulates are fine and they can lead to lung disease like a silicosis. But dust storms, when you hit, and we're going to talk about pollens later, that can mix dust and pollen. Or if there's a fire nearby, it can mix the dust and the fire. So dust storms in general create a lot of particulate matter, a little bit different than this particulate matter, but it is still damaging and irritating to the lungs. And you'll see it, when I was in Iraq, we had a really bad dust storm that lasted for 20 hours. And it looked very similar to the lady in the picture that we had before with the mask and kind of a red haze. And you just were covered with this fine material and had to have a mask to breathe. It was kind of miserable, but that's how it affects the lungs. So it's a different irritant, but similar effects. Does that answer the question?
I think so. There doesn't seem to, yes, it does. Thanks.
Perfect. Cool. Um, and oh, another question. Looks like connect why climate change is causing more dust. Yeah. So a couple aspects of climate change leading to dust. One, with climate change, we're getting more severe storms and more droughts, which lead to the normal rainfall will help moisturize the soil, leads to plant growth. And so that's one aspect, right? If you have more plants, it's keeping the dust levels down. So that's an aspect that's the longer or the more droughts that we have, the more dust that's created, and that can then be spread. Other aspects include like deforestation or farming techniques. So without using regenerative farming and processes where you're tilling the land, if you notice there's a lot where places are tilling, so they're turning over that dirt all the time, that creates a lot of dust and particulate, and it's not healthy for the soil either. So some farmers are doing a no-till farming, and that will help lead to both regenerative agricultural techniques, but it also leads to less dust. And then in terms of other aspects, just with deforestation and taking away plants and natural habitat, an ecosystem by itself does pretty well to keep the dust down. But when you start destroying that ecosystem, there is a lot more dust. If you think about the Dust Bowl, right, that was from dryness and farming and poor farming practices, where basically all of that topsoil blew away from the Midwest portions of the country. So yeah, climate change is definitely leading to a lot more dust, and we're a big component of that. Cool. Any other questions? Let's see. Cool. So we talk about the particulates from wildfires. We're talking about, does everyone that's exposed have lung disease? No, not necessarily, right? So the more you're exposed in terms of more smoke, more particulates, closer to the fire, it leads to a higher exposure. You balance that with the underlying lung disease of the patient, and in a sense, their susceptibility to that. And that combination then will lead to your outcome and a higher chance. So the more you're exposed and the more you're at risk, the higher chance you are to have a worse outcome from that exposure. So a lot of patients will be exposed, or people are exposed to the smoke, but they don't really have any symptoms, or the symptoms they don't even realize. They're like, oh, it smells funny, but they didn't have trouble breathing. They don't seek healthcare. They don't change their medication usage. They don't go to the hospital. There's other patients that will have some symptoms, but can manage it by themselves. Maybe I have a cough for a few days. I try to stay inside. I'm okay. Other patients may use their albuterol more or increase their oxygen, their home oxygen they're on. Sometimes they'll have to go to the ER, an urgent care physician's office, or even be hospitalized. The 33,000 relates to how many deaths that the Lancet study in 2021 found were due to wildfires worldwide. So wildfires definitely are a cause of death out there. And it's hard to truly, as this image describes, it's hard to get the total impact of health of the particulates, but we definitely can measure certain aspects with death and hospitalizations based on those exposed. So the hard part with particulate now is it can be exposed, our whole country could be exposed from a single fire in California or Montana based on the wind patterns. All right, any other questions on particulates before we go on to allergens? Well, next slide.
Not at this time.
So we talk about allergens. Allergens, in a sense, are pollen. So it's the flowering portion of a tree or a grass or a weed. And we've noticed probably in the last 50 years that the average pollen season in locations has increased by about 80%. So almost doubled the duration. And why is this happening? It's happening because carbon dioxide, though we know its effects on climate change and global warming, that's the building block for what plants use. So as there's more carbon dioxide in the atmosphere, there's more potential building blocks for those plants. So they can grow more with that exposure. As the cartoon shows here, as the carbon dioxide level has increased over the years, the pollen has also increased. And if we do some cutting of those emissions from carbon dioxide, we can decrease the amount of pollen. Next slide. And the hard part with these pollens and allergens, they're disproportionately affecting both minority and low income patients and people across our country and the world. And as we're having increased, carbon dioxide with a warmer planet, this is also leading to longer growing seasons. There's less frost days, and frost days, help slow the plant from flowering and maturing. So it kind of shuts it down. So if you don't have those frost days and you have a longer growing season, the plant's happy, right? It's like, I want to go pollinate. I just want to go spread my wings and produce more little baby plants. But that's not good for us for, sucking in that pollen over long periods of time. I know here in Arizona, this has been one of the worst allergen seasons here. I've had really bad allergies myself with a cough, and I even gave myself, I think, a small corneal abrasion rubbing my eyes because it was so itchy overnight. But the other things with climate change, because of the change in seasons and the increased heat that we're seeing in different places and the wind that's picking up, that's leading to spread of these pollens to other places where they didn't grow before. So plants are, in a sense, migrating through wind and climate change to areas in which they had not normally grown in the past. So this is exposing more patients to that same pollen over a period of time. Next slide. So when we talk about, what these allergens are doing, they can cause different effects for patients. Things like hay fever, allergic rhinitis. That's usually patients are sneezing, runny nose, congestion, kind of a really upper airway sensation from the pollens and the irritants there. You can also get eye irritation, like I was mentioning before. You can get an allergic conjunctivitis or inflammation of the white part of the lining or the white part of your eye. And that can lead to redness, watering, itchy eyes. And then patients with lung disease, underlying COPD or pulmonary fibrosis, they can have problems with increasing cough, wheezing, and shortness of breath symptoms. And so this interrelation, because of the body's immune response to these allergens, leads to these effects that can lead to chronic inflammation and scarring in your pulmonary tissue. Now, a lot of people the last few months have said, well, is it COVID? Is it an allergy? And you can see by the diagram here, there's a lot of overlap between COVID and allergies. I think some of the things I look at for differentiating would be, if someone's sneezing or have watery eyes, that's probably more allergies versus if they're having, diarrhea or losing taste or smell, maybe fevers and chills, those are probably more COVID. But in terms of the cough and the fatigue and trouble breathing, runny nose even, that can be overlap from both of those. Any questions on allergens? We'll go ahead to greenhouse gases. So we talk about greenhouse gases. There's really 4 that we're talking about. So we talk about carbon dioxide, and we use that as kind of a measuring standard. So the other gases, in a sense, are looked at of how much more potent they are at holding in heat than carbon dioxide. And there's some ranges with this, in terms of how long each of these components last in the atmosphere. So, but just as this is kind of rough estimate numbers. So methane, which is carbon and 4 hydrogens, is about 25 times as potent as carbon dioxide. And methane we see coming from a couple places. One, probably the biggest one, is coming, in a sense, it's natural gas and coming from the drilling of oil and gas with pipelines. And a lot of that methane just gets leaked out, in a sense. So when you say, like, I'm using natural gas, people are using natural gas maybe on their stove at home, or they're burning it or consuming that methane. So it at least has been used to some point. Some of the methane that's being released is just coming straight out of the ground without being used. And there's lots of leakage in those areas that we could work on. what I was saying, potent in terms of just, it's like a currency, I guess, right? So, one carbon dioxide would be equal to, or excuse me, one methane would be equal to 25 carbon dioxides in the atmosphere in terms of causing that effect, if that answers the question. Ozone's about 80 times that of CO2, and nitric oxide is about 300. And we talked about ozone earlier, so we know where that comes from. Nitric oxides are coming from animal waste as well as from fertilizer production. So that's a big industry. And we talk about where these greenhouse gases are coming from. The image here is just kind of breaking down what are the major areas. So electricity and heat is a huge, and we say heat, that also goes with air conditioning, because one of the biggest energy consumption or problems environmentally that we could impact is refrigerant use in general. So electricity and that production of fossil fuels is one of the biggest ones. We talk about agriculture and land. Well, methane is released from some of these feedlots with cows and animal production, but it's also the greenhouse gases that are going into some of the products that are required for land and agriculture. So a lot of those require fertilizers. The land and agriculture uses a lot of heavy machinery that uses fossil fuels to run the tractor. And the more times I use the tractor, the more fuel I'll use. Other things included like fertilizers, pesticides. That's a petrochemical industry that uses a lot of energy and is required to make their products. So that's where some of the land and agricultural use. Industry, big things, cement, steel, fertilizer we've mentioned before. Those are high energy inputs and are relying on fossil fuels being burned. We're trying to convert some of those to decrease it. And then transportation. So you hear people talk about electric vehicles and that component, electrifying things and not using fossil fuels for transportation. So those are kind of the big four areas for greenhouse gases. Any questions on greenhouse gases? Cool. Next slide. So let's talk about how we could, protect ourselves in a lot of these, how do we protect ourselves, our patients, our family members, are through some simple modifying techniques. So for ground level, low zone, ozone, a couple things would be, one, you could go to this website and just learn about air quality indexes. What is the air quality in your area today? Depending on what that air quality is, may determine what your activities are going to be. So when the air quality is good, you're probably good to go. You can be outside and life's going to be fine, no issues. But as that air quality gets worse, maybe you want to limit your activities going outdoors on those moderate and high days. And if you do go outdoors, trying to modify it and say, well, I'll go out when the ozone's lower. And so that would be in the morning and the evening, right? So the high heat of the day, the hotter it is, the more heat it is, those are the times you want to avoid the ozone out there. And maybe you change your exercise pattern. Instead of exercising or running errands during the heat of the day, you switch that to a different day of the week or a morning or evening based on the air quality level. Next slide. In terms of wildfires, there's a lot you can try to do. Obviously, the best way to be is not around a wildfire. So if you're not around the wildfire and you don't smell the smoke, then that's a good thing, right? You've probably eliminated your exposure to wildfires. But a lot of us can't just move and relocate. That's expensive and not easy. And you can't well, there's a fire, I'm going to leave for 6 months and then come back. And with the increased winds and the dust and the particulate matter that's getting spread across our country with these, even if you move and relocate, you may still be affected, 1, 2, 4, 5 states over. So that elimination and relocation may not be the ideal way to go. Now, there's some things you can do if you can't move. If it's smoky and there's a wildfire nearby, don't open your windows, right? Close your windows, close your doors. You can probably try to do put your air conditioner on a recirculation mode. So you're decreasing the outdoor particulates from coming in. You can put HEPA filters, in your heating ventilation units as well to try to strain stuff out. Other things are just modifying behaviors, right? Not going outdoors in those times, or decreasing your heavy activity or prolonged exposure outdoor. Maybe, okay, I got to go outdoors real quick, but I won't spend too long out there. I'll not work outside today. I'll stay inside. You can try to wear a mask or protective equipment, but those, they have to fit right. It probably needs to be an N95 or a P100. Certain masks may work, but it's hard to put those on kids. It's hard to put them for a prolonged period of time. You're going to have to take it off to eat at some point. So wildfires are pretty tough avoiding all of this. You can try to minimize things, but the best thing will be obviously prevention and not having wildfires and trying to avoid those in the future. Next slide. Pollen's similar, right? So if it's looking for pollen levels and seeing if they're high or low for a period of time, and then avoiding the pollen, right? So if it's high pollen day, you're going outside and you're exposing yourself, you're going to be at more risk. So try to avoid those. And then the times when you do have to go outside and there's pollen, when you come inside, trying to remove that pollen. So changing your clothes from what you wear, washing your face and hair, taking off your shoes when you come into the house. Those would all be ideas of not bringing that pollen inside, so you're not exposing yourself. Any questions on some of those protective strategies?
There are no questions at this time.
Cool. All right, so we'll go on, next slide. So what can we do about this, right? We know that climate change is hurting our health, and we know that climate change is affecting minority and low income patients at a higher level than other people. But I kind of break this down into two areas. So the individual level, so that's individual decisions individually, what you're doing on an everyday basis, versus policy action. And policy is, governmental, nonprofit, organizational aspects, and how you can influence them to have a larger influence for a greater number of people. So let's talk about each of these. Next slide. So individually, probably the biggest thing you can do is vote, right? You vote for people that you think are going to be best serving your interests in terms of helping. They're putting in policies in place for climate change. They are supporting the ideas that you support. So voting is huge, and it's going to be hard to affect any policy level if you don't vote. Another aspect, though, that all of us can do, and that's why you're here today, is educating yourself. So trying to learn a little bit more on the topic. That's how I started, right? It's not that you're going to know everything about climate change or its effect on people's health overnight, but just taking it a little bit each day, being interested, seeking answers or information that will help you understand the concepts. Because if you understand these concepts, it's going to be easier to share and talk about it with other patients or other people, your friends, your neighbors. So you, by educating yourself, will be a resource that people will go to, and you'll have better answers when people are like, oh no, this doesn't exist, this doesn't happen. You're like, well, actually it does, and here's some things. Another aspect would be serving as an example. So in a sense, putting your money where your mouth is, and in some ways, and walking the walk, talking the talk. So a couple things in terms of the education component to help be an example. So one great resource I think is Project Drawdown. We'll put the link for their website on in the chat here. But Project Drawdown is a nonprofit that is working it's a large number of scholars, but they have a great website, and there's a book you can read about it. And they have looked at, what are the big impacts that we could change in terms of carbon dioxide production. And they use that from different industries, whether it's talking about, educating girls, to refrigerant use, to alternative transportation, to windmills. So it's looking at all of that, looking at plant-based diet, some of these things that can have big impacts, and kind of measuring them and how we would be able to implement them. So it's a great way to start with different aspects of things that we can do, with the concept of not continuing to increase our CO2 production. We're trying to decrease that increase, so that we're trying to level that curve of the CO2 production. But what we really want to do is we got to draw it down. So the thought is we're decreasing the amount of carbon dioxide in the atmosphere. And so that's what they're based on. Another area in terms of educating yourself, I think, is the How to Save a Planet podcast. It's pretty good. If you want podcasts, you don't want to read, you just want to listen to something, we'll put a link to that. And they talk about individual action versus policy action, talking about electric vehicles or nuclear and different. And so they kind of weigh and have discussion and talk to experts. So it gives you a good background on those. And then in terms of other things that you can do to serve as your example, does your individual action matter? Well, just because, I recycle today, or I don't use plastic bags, is that me not using a plastic bag today going to make a big difference? Probably not. But if I don't use plastic bags and someone else sees that, then they don't use plastic bags, and then someone else sees it, and that starts to propagate. Now, all of a sudden, 1 million people, 10 million people stop using plastic bags. That's how you'll make a difference on the individual level. So individually, you may not, but just by you serving and trying to do the right thing and trying to make an impact, well, others will note that. I've had people like, well, yeah, I thought about this and we're going to use napkins, but then Brian doesn't like paper napkins, so we just use cloth napkins and hope that's okay. So you influence people like, oh, I don't want to make him upset, so I'll do something else. But they're thinking about it, right? So you get them in their conscious, like, oh gosh, I better do the right thing, or I'll be in trouble. So serving as an example is important. And then in terms of like financial decisions, a cool website. So I love impact investing and kind of climate finance as well. And so we're going to put a link here for fossilfreefunds.org. So whether you have a retirement or you're trying to do some investing, fossilfreefunds.org is a great place. You could put in your mutual funds that whether your company's invested in or whoever's invested in, you're just doing it yourself, put in the actual fund, and then it grades it out and says, okay, your deforestation grade's a C, your something else is a B, and so you can try to change those and get as many A's. I found out like one of my funds was invested in nuclear weapons. I was like, oh, that's not good. I got to get out of this fund. So it's not that every fund is like 100%, but it really breaks it down, on women leadership. It does gun violence and smoking or tobacco. So just a way to change your finances around that you're actually funding pro-climate activities. So a lot of individual things that we can all do to help make a change here. Next slide. So we talk about policy, it's a little bit different, right? So in the policy, none of us are, maybe some of us here are legislators, but I'm not a legislator. I can't make a policy for the city, state, or Western United States. But all of us individually can vote, and that helps put the policy players in the position that you want them to. So again, voting is super important. The other thing would be, how to get involved on policy levels. You could call those legislator or policymakers, show up to their meetings, have your voice be heard, write letters, get other people to advocate for these causes, and then joining an advocacy group, finding local groups or state or national groups that you support and their mission helps align with your ideals and what you're trying to accomplish. Maybe you just listen to their meetings. Maybe you help them out with certain aspects, but that would be a great way to get involved on a policy level. Next slide. So today, hopefully we've talked about the impact of 4 different areas on respiratory health. So we've kind of talked about low zone ozone and its effect in the heat of the day, and where it comes from. We've talked about wildfire particulates, and how they can cause lung damage, or not just locally, but because of the spread with climate change and wind that they spread across the country. We talked about allergens and the longer growing season, leading to a chronic inflammatory state in patients' lungs. Then we talked about greenhouse gases and where they're coming from. And then we talked about some things we can do with modifying, trying to remove ourselves from the higher exposure timeframes, and then talked about how we, on an individual and policy aspect, can go about and try to make a difference with what we're doing. So anyway, I hope that was helpful to you guys today. And I think we'll open up for questions or comments or anything that you want to talk about.
No questions yet, but we did get one. This was fantastic, Brian, really clear and helpful. So thank you, Rhonda, for that.
Do I know the lengthening allergy season for Nevada? I don't know specific information on Nevada's allergy season. There are, like some of the worst allergy, there's publications of what cities have the most allergies and the longest or the increased growth, whether that's in the summer or fall. So there is information on some of those. Part of it is removing yourself from your, allergy. The pollens are kind of a chronic component too. So just because if I live in one area for a short period of time, I may not get that immune response built up to have an allergic reaction. I moved to Tucson 10 years ago, didn't have it. And now it's gotten worse each year. So kind of the exposure over time. And then going to other locations. I was just in San Diego a week ago, and I went there and all my symptoms went away. It was wonderful. Maybe that's because I was in the ocean and didn't have pollen on me, but just changing locations sometimes can break that cycle. But with Nevada, just like any place, Nevada's going to have a lot of dust, and depending on where you're located in the state, can lead to different allergens at different times of year. So certain seasons are more potent for certain areas. Hope that answers your question, Burnett. Any other questions or thoughts?
We did.
Yeah. Do you think diet can help reduce allergic tendencies? Yeah, this is kind of an area I think people are doing a lot of research on terms of just inflammation in the body in general. People talk about eating clean and what you're putting in your body matters. And I think that probably makes logical sense. I don't know if the hard science is 100% there. But in terms of anything that's in general, if you have more processed foods, more foods that you're putting in your body that have had chemicals or modifications, you're probably going to be at a higher risk of, some kind of inflammatory response. There was I think they were looking at even like the plastic breakdown components in water, and what levels do we need to hit for water filtration for municipalities and utilities, and the membranes that they use, will that help filter them out? And they really want them to get to like 0 now. I think we're realizing that maybe any small plastics or some of the fast food, fried foods, processed foods probably lead to more inflammation and are less healthy for your body in general on multiple aspects, whether that's arthritis or maybe early dementia, cancer risks. And I think allergies fall into that same concept. So eating clean, going to more of a plant-based diet, there's That's a big one, if you would say, in terms of climate change in general. Plant-based diet is something I've changed myself. I still love barbecue. I will probably continue to have barbecue at different points, but I don't have meat every day. And so that's a big difference. My son's environmental science class had a graph in their book that they took all the calories produced by all the plants that we produce in our food industry across the world, by all the caloric needs of people, and the plants that we produce meet everybody's caloric needs. No one will go hungry. If we took just straight meat and all the calories produced from meat, it doesn't meet all the needs calorically. So that's just a math equation to me that yes, you should have more plants than meat, because that's the only way we can feed people and make caloric needs. So having a plant-based diet. So we try to do like a weekday vegetarian. We're not eating meat 5 days out of the week, but if I want a pizza with pepperoni on the weekends, that's okay. So trying to decrease some of the diets, stuff that you put into your body would probably help with your allergic tendencies. Oh, nice. Cool link.
Yeah, thank you.
So kind of a long answer to your question, Rhonda. Hopefully that addressed it. But anything else? Other thoughts or things you guys want to talk about?
Hey, Brian, is there anything that we can do specifically for, kids and allergies and I know you touched on it earlier, but, having them missing more days from school because of allergies or asthma attacks. Are there anything specific we can do for them?
Yeah, for kids who have like asthma or other issues, I think the big thing is, making sure you have a good asthma action plan worked out with your pediatrician or your respiratory doctor. If you have that, that's probably the number one thing that you want. Making sure you have refills on your medications for those kiddos too. Making sure they have the albuterol. They have a spacer with the albuterol that they're using that, and not, or if they're using a nebulizer, having that. And then making sure that they can take those medicines to school, that the nurses are up to speed in the school for that utilization. In terms of like allergies in kids, we're seeing a lot more allergies in general in kids. There's a lot of food allergies, and those probably, you can't say they're 100% climate change, but it's probably the modifications that we've done, the preservatives and things that we've added have led to some of those increased allergies over time. I don't have proof of that. This is kind of my working theory in terms of, the number of food allergies when I was a kid with other kids, we just didn't see, but they're much more common now. So trying to, just have a good plan for, your kids with allergies. And then if they do start to have allergy symptoms, to get them on medicine so that they're breathing okay, whether it's decongestants or antihistamines, those even inhaled, either respiratory nasal steroids or oral or inhaled steroids are much better than the oral steroids in terms of on those kids' bodies going forward. Let's see, another question. We're using natural gas in the home. Is there an increased lung risk? Yes. So this has started to come out. A lot of people love this is a very polarizing topic, because some people love their electric gas or induction stoves. So natural gas, some people swear by, that's the only way I'm going to cook. But cooking with natural gas does expose you, right? So it is, in a sense, you're burning methane in your house, or some people's natural gas is a propane stove, right? A large propane tank from the outside, because they're not hooked up to the gas line. But that does release chemicals into your house every time you do that, that increase your lung risk. So, ideally you would switch over to an electric stove. One, good for the environment. Two, good for you. In terms of, a lot of people don't like electric stoves, but if you have an induction cooktop or an induction hot plate, those are great. I have induction here at my house. The induction is based on a magnetic heating, so you have to have a iron-based skillet, so it can't be all aluminum. You can check by just putting a magnet against your skillet. If your magnet sticks to the skillet, then you got the right cookware. If not, you would have to change your cookware for that. But induction based, boils water super fast, almost faster than gas, and I love it. I cook with it all the time. It's a little less cost. I mean, there may be a cost for buying the new stovetop or hot plate of induction, but it's much healthier for you. And if you put solar panels on your roof, your own clean generation of electricity would be a huge individual decision and impact. And then you tie that into an induction stove is a great way to do it. Does that answer, Kristen? Yeah, so in terms of, Rhonda was asking if there's other allergy, in addition to like allergy medicines, is there something else that you can try, allergy shots and other options? Yeah, I think, I leave this to the allergists and immunologists that work on it, but I think allergy shots are probably a pretty good way to go if you're having difficulty taking some of the allergy medicines. The other things, is looking at different classes of those medicines. If the medicines, if one medicine is not working, can you try a different class, and maybe that would help and, not have as many side effects and more effective for you. But in terms of, there's a limited number of options that we can do for allergies. Unfortunately, it's, some antihistamines, some decongestants, albuterol, steroids. There's a few, mainstays of treatment. In terms of prevention, modifying your pollen exposure and allergy shots are probably kind of the big ones that I know of. Hopefully that answers your question, Rhonda. Good questions, you guys, yeah. Any last questions?
I don't see any others coming through. Last call for questions.
Thank you, Rhonda. Very nice.
Okay. Well, if there are no more questions, I'd like to take this time to thank you, Brian, for this amazing presentation. Very informative and lots of great information. I'm always really excited when we learn something. Kristen and I have been doing these for quite a few months, and every time we walk away with some information that we learned as well. If anyone on the call would like to support the American Lung Association in Arizona or Nevada, please reach out to us via email at eventsaz@lung.org. Also, we will be sending out a survey. Please give us your feedback on this webinar. And if you've joined us for any previously, please give us feedback on those as well. We'd love to know what you thought about this webinar today and the series in general. As we wrap up, I'd like to also just mention that go to lung.org and sign up for Stand Up for Clean Air. It just asks you to take a pledge, to join the fight for clean air. And we will also keep in touch with you and let you know when there are opportunities to take action. So Brian mentioned today about writing those letters and making those phone calls and making your voice heard when it comes to things like clean air action initiatives in your community. So if you sign up for Stand Up for Clean Air, we can keep you in the loop on when those action alerts are out and what you can do to help get your voice heard. There is also our healthcare professionals for clean air and climate change. It's one of our action groups. If you are a healthcare professional, if you go to Stand Up for Clean Air, you can also sign up to be a member of that group. I know some of the names that I saw as participants today are members. So please, we're always looking for people to join us on that committee as well. Thank you, Kristen. Yeah, so again, thank you for joining us today. We are very excited to have wrapped up our series on air pollution in Arizona and Nevada. We thank you, Brian, so much for this great presentation. We invite you guys all to join us. Hopefully we'll be back here next year presenting on improvements on the air quality in all of our communities. But thank you so much. Look for that survey, and if there are any questions, please feel free to send them to events@az@lung.org, and we will definitely get those answered for you as well. Thank you guys all so much, and it looks like we're done about 4 minutes early, so I'm happy to give you guys 4 minutes back in your very busy day. Thank you so much. Bye-bye, everybody.